Bismillahirrahmanirrahim. So let's talk about the posterior circulation. This is the third video in the neuroanatomy, right? So let's talk about posterior circulation. So I have drawn a diagram here. So let's discuss about the. Okay, so this one is the midbrain. What I'm drawing in the green. So this is the midbrain. Then we have got this is actually the lateral view. So this one is called as the pons. This is midbrain, pons. Then the next thing is the medulla, right? So this one is the medulla, and this junction is called as pontomedullary junction, right? And this one is called as the superior cerebellar peduncle. Then we have middle cerebellar peduncle, that is gonna connect the pons to the cerebellum. This is cerebellum, right? And this one is called as the inferior cerebellar peduncle, right? This is gonna connect the medulla to the cerebellum, right? So let's discuss the circulations related to these. So let me undo these areas, right? Okay, so that my circulation is gonna, right? So we have the branches that is of the posterior circulation, right? So this one is called as the vertebral artery. Okay, so these both are gonna ascend upward and they're gonna unite at the pontomedullary junction. So these are called as the vertebral arteries. Then they're gonna form this artery that is called as the basilar artery. So this artery is called as the basilar artery, that is gonna run on the anterior aspect of the pons. This is okay. All right, so then the last branch is called as the posterior cerebral artery. What I'm highlighting here, so up to this dot, up to this area, this segment is called as the P1 segment of posterior cerebral artery. Cerebral artery, right? So this is P1 segment, and the next segment that is going to supply the occipital cortex, this is called as the P2 segment of the posterior cerebral artery. So this is the P2 segment of the posterior cerebral artery. So P1 segment is going to supply the midbrain, right? And the P2 is going to supply the occipital cortex, right? So let's discuss the other branches related to this. Okay, so we have the another branch that arises from both of these vertebral arteries, and then it unites and runs downward. This is called as the anterior spinal artery, right? So this is anterior spinal artery, this is vertebral artery, and from the vertebral artery we have another branch, right? So that is going to supply the medulla. This is called as the PICA, right? Posterior inferior cerebellar artery, right? Okay, and from the basilar artery we have another branch that is going to supply the anterior aspect of the cerebellum and the inferior aspect. So this is called as ICA, anterior inferior cerebellar artery, right? Okay, so we'll have the other branch that is running like that. Okay, so we have the last branch that is called as the superior cerebellar artery, that is going to supply the superior part of cerebellum, right? So this is called as the superior cerebellar artery, right? So what happens when we if we block the P1 PC, if there is some embolus in this P1 posterior cerebral artery, so we'll have the midbrain stroke, right? So I'm going to discuss each of these strokes subsequently. All right, so when we block one branch of the P2 PCA, P2 posterior cerebral artery, the patient is going to have the visual hallucinations. If we block both of these P2 PCA portions, so we'll have the Anton syndrome. So I have discussed the Anton syndrome in the last video. Okay, so if we block this artery, so let me highlight this area. If we block the basilar artery, so what's going to happen? There will be pontine stroke, right? So patients are going to have the pontine stroke when we block the basilar artery. So we have the medulla that is going to supply the vertebral artery is going to supply the medulla, right? So we'll have the medial medullary syndrome, right? Actually this vertebral artery is going to supply the medial aspect of the medulla, right? So if we anterior spinal artery is going to supply the medial aspect of medulla. If we block that, so patient is going to have medial medullary syndrome. And if we block the lateral part of if we block the vertebral arteries, right? If we block another thing is that if uh, pica is also going to supply the lateral aspect of medulla, and vertebral artery is also going to supply the lateral aspect of medulla. So when we block that, when there is some atheroembolism in that, so what's going to happen? So patient is going to have the features of lateral medullary syndrome, right? Okay. And if we block the anterior inferior cerebellar artery, this artery, so right, so this is also going to supply the lower part of bones and upper part of medulla. So patient is going to have the seventh and eighth cranial nerve pulses related to that. If we block the superior cerebral artery, this one, right, superior cerebellar artery, so patient is having the Horner syndrome. Along with that, patient is going to having the gait ataxia and hypotonia, right? Usually we see the hypertonia in the upper motor neuron region, but any problem in the cerebellum, that is going to cause the hypotonia, right? Okay. In the medial medullary syndrome, we know that on the medial aspect there is 12th cranial nerve, right, and that is present medially. So if the patient is having features like a patient is having the hemiplegia, and along with that patient is having 12th nerve palsy, so we're going to think that the patient is having the medial medullary syndrome, and the artery involved, that is called as the anterior spinal artery. Okay, if the patient is having 5th, 7th, 8th, 9th, and 10th, 11th cranial nerve involvement, right? Alright, so we have the multiple, if we have got the multiple nerve involvement, right? And along with that, patient is having Gardner syndrome, so we're going to think the patient is having lateral medullary syndrome, right? If we have got the features of 7th and 8th cranial nerve pulses, right? And the patient is having we're gonna think that patient is having the anterior inferior cerebral artery involved in these patients, right? So that's all about the second part of the the third part of the neuroanatomy, and we're gonna discuss all of these syndromes in the next video. Okay.